Are you trying to improve the appearance of your double chin or thinking about Kybella versus chin liposuction? Hi, I'm Dr. Dominic Castellano, Elite Facial Plastic Surgery. Today I'm going to talk to you about those two options, which I often see. If you want to learn more about double chin treatment, check out my playlist below. Many times patients are, wanting to have improvement in the way things look, but are wanting minimal downtime and no surgery. So there are options, and one of the options is Kybella. Kybella is a product that's essentially injected into the submental, or what some patients like to refer to as the chin area. And what it's meant to do is dissolve the fat that's present in the neck area. Now, it'll work towards getting a good result. However, it's not as precise as, let's say, using something like liposuction, which is a surgical procedure. However, the benefit is that you don't require any surgery and you normally don't need any anesthesia. Now, the downtime part is a little bit tricky because with no downtime, you think that there's no visible evidence of it having been done. So in actuality, though, when you do have the Kybella treatment, you do get a fair amount of swelling, and that swelling can take a couple weeks to resolve. But it's not like you're going to be getting bruising, let's say, with like a surgical procedure. Now, this brings me to the surgical side, what we call cervical or chin liposuction. With that procedure, it does require anesthesia. It could be something as simple as local anesthesia, where you inject some numbing medicine in the site to be treated, or you could have IV sedation or general anesthesia. The point is, you do need some anesthesia compared to the Kybella. Now, with the liposuction, you do require to have a small incision, and usually that incision is made in a natural skin crease between the chin and the neck, and that incision is usually about 4 millimeters. So the incision is very small, and it typically is closed with 1 to 2 absorbable sutures. With liposuction, you're going to have a little bit more downtime, and I do normally like to put you in an elastic garment. The elastic garment basically goes under the chin and neck area that underwent the liposuction, and then it velcros on the top of the head. Ideally, I'd like for you to wear that for about 24 to 36 hours, and then after that point, you can wear the garment when you sleep at night if you so desired. Most patients can get back to a normal activity, which involves going back to the gym within about 36 hours. Now, with liposuction compared to Kybella, there is a greater risk of having bruising, and that's just because it's a surgical procedure. But if you are on blood thinning agents, you should discuss that with your surgeon. Now, the other plus to the liposuction compared to the Kybella is with the liposuction, we utilize different cannulas, which means different sizes to remove the fat, which allows us to be a little bit more precise and to kind of fine-tune the area that you're treating. In addition, it's precise from the standpoint that we are treating the whole neck area and actually visibly doing it. Whereas with the Kybella, you're essentially ejecting it into different parts of the neck following a grid-like pattern. Both options are going to get you some improvement, but I do believe that the liposuction part is a little bit more precise and a bit more definitive for sure. Either way, I think you'll be happy with getting some correction. It really just depends upon how much correction you're wanting, as well as downtime. Another factor that comes into play is the number of treatment sessions. With Kybella, I normally would tell patients that you're going to be certainly willing to do more than one treatment session, unless you have a very small amount of fat in the submental area. With liposuction, you normally can get the result you're looking to achieve with one treatment. Every patient is different, but I'd say for the most part with Kybella, you can bank on having more than one treatment, whereas with cervical liposuction, you only need one. The next part of both procedures is the pain level. And with Kybella, you don't require an incision. It requires small needle pricks to treat the area of the Kybella. However, some patients do experience some burning associated with the actual procedure itself. Many times patients will put some cold pack, for instance, while they're being treated to help with the heat sensation, and ultimately that heat will dissipate. Whereas with the cervical liposuction and doing the procedure, there is some discomfort when you're getting the area numb, and that numbing process usually takes about 30 to 45 seconds. Afterwards, both procedures I think is described as more soreness. They typically can be managed with Tylenol or Motrin. Very rarely do patients need any kind of narcotics. So Kybella, pros and cons. One of the pros that it does not require surgery. It does not require any anesthesia. One of the cons, though, that factors into it is certainly that you may need more than one treatment. And depending upon how many treatments you do, it could get costly. Another benefit, the ability to get back to normal activity, is within a day or so. Now, cervical liposuction, the cons are it does require anesthesia. It is a surgical procedure. There could be a little bit more swelling and certainly bruising compared to Kybella. However, the pros is that you're normally able to achieve a really great result with one treatment, and most patients are very happy with having one treatment compared to needing more than one with Kybella. Which double chin treatment is best for you? So the long and short is that for somebody who's looking to get improvement but doesn't want surgery and doesn't have a very, what I would describe as a heavy neck, then I think Kybella is a great option because you won't require surgery, won't require any anesthesia, and you can get back to your normal routine things fairly quickly. Now, if you're looking for a procedure that's going to be more definitive, because with surgery, you can be more precise in addressing the areas of fat, and you want to have one procedure and not necessarily have to undergo multiple treatments with Kybella, then I think at that point in time, the chin lipo would be your best option.